amount of fluid remaining in the bag. What is the purpose of determining the amount of fluid required for complete transport time? To ensure enough fluid is available for the entire transport. What should be done if more fluid is needed during transport? Obtain additional fluid. What should be documented on the ambulance call report regarding pre-transport IV information? All pre-transport IV information should be documented. What is the responsibility during transport in relation to the IV? Monitor and maintain the IV at the prescribed rate. What should be done if the IV becomes dislodged or interstitial? Discontinue the IV flow and remove the catheter with aseptic technique. What should be done to confirm the condition of the catheter if it is removed? The condition of the catheter should be confirmed. When should the IV bag be changed? The IV bag should be changed when there is approximately 150 ml of solution remaining. Load and go patient standard. A directive for paramedics to initiate rapid transport for certain patients. General directive. Guidelines for paramedics to follow during patient transport. CTS-1 patients. Patients with the highest level of acuity according to the pre-hospital paramedic CTAS guide. Bypass protocols. Protocols that allow paramedics to bypass certain hospitals and transport patients directly to specialized centers. Field trauma triage. A protocol that determines which trauma patients should be transported to a trauma center. Stroke. A condition where blood flow to the brain is interrupted, requiring rapid transport to a stroke center. Obstetrical patients. Patients who are pregnant or in labor. Eclampsia/pre-eclampsia. A condition characterized by high blood pressure during pregnancy, which may require rapid transport. Limb presentation. A complication during childbirth where the baby's limb presents first, requiring rapid transport. Multiple births expected. When a pregnant patient is expected to give birth to more than one baby, requiring rapid transport. Premature labor. When a pregnant patient goes into labor before the expected due date, requiring rapid transport. Umbilical cord prolapse. A complication during childbirth where the umbilical cord slips through the cervix before the baby, requiring rapid transport. Vital signs absent patients. Patients who are in cardiac arrest and do not have any signs of life. TOR. Termination of resuscitation, a decision made by paramedics to stop resuscitation efforts. ALS/PCS. Advanced Life Support Patient Care Standards, guidelines for paramedics to determine when to initiate or withhold certain interventions. Life-saving interventions. immediate medical procedures or treatments that are necessary to save a patient's life. Delivery appears imminent. When a pregnant patient is about to give birth, requiring immediate medical attention. What is the police notification standard? Ensuring police are notified in unusual or suspicious situations. What is the general directive for paramedics? Notify police in cases involving sudden death, violence, foul play, or accidents with emergency vehicles. How should paramedics request police assistance? Contact CCC/ACS, state nature of request, indicate urgency, advise of hazards, provide access routes, and update police on arrival. What radio code should be used to contact police in extenuating circumstances? 10 to 200 for no immediate danger, 10 to 2000 for immediate danger, an emergency button on radio. Why is the use of police vehicle escorts discouraged during transport? Due to the prevalent danger it presents. What should be done in cases of suspected foul play? Efforts should be made to leave the scene undisturbed and preserve evidence for the police. What should be noted when moving a body? Once moved, it can never be put back in its original position. What should paramedics be careful about when moving something? Careful attention is required to avoid any damage or disturbance. What path should be used when accessing the patient and leaving the scene? The shortest, most direct path. What should be done with linen/clothes after call completion in cases of suspected foul play? Do not discard without checking with the receiving facility or investigating officer. What are some examples of unusual or suspicious situations that require police notification? Sudden death, violence, foul play, accidents involving emergency vehicles. Who should paramedics contact when requesting police assistance? CCC/ACS via radio or telephone. What information should paramedics provide when requesting police assistance? Nature of the request, urgency of response, estimated time of arrival, possible hazards, and access routes. What should paramedics do when police arrive at the scene? Provide them with an update of the situation. What is the purpose of using radio codes to contact police? To communicate the level of danger or urgency in extenuating circumstances. What is the purpose of preserving the chain of evidence in cases of suspected foul play? To ensure the integrity of the investigation and any potential legal proceedings. What should be done with discarded linen/clothes in cases of suspected foul play? Do not discard without checking with the receiving facility or investigating officer. Why should paramedics use the shortest, most direct path when accessing the patient and leaving the scene? To minimize any potential disturbance or contamination of the scene. What is the Emergency Health Regulatory and Accountability Branch responsible for? Overseeing the standards of care in emergency health services. What is the purpose of notifying police in cases involving unusual or suspicious situations? To ensure the safety of the paramedics and the public, and to assist in any necessary investigations. What are special precautions for cases of hanging? Careful observation of rope position, preservation of knot. What should receiving facility staff be cautioned about? Suspected foul play. When should the rope be cut in cases of hanging? If it cannot be readily slipped off. What should a paramedic do in situations involving a patient who is reported to have been sexually assaulted? Ensure the patient is not left alone. What should a paramedic do if the patient is a child and reported to have been sexually assaulted? Follow the child in need of protection standard. What should a paramedic do in situations where police are not on the scene and a patient is reported to have been sexually assaulted? Offer to contact the police. What should a paramedic do if a patient declines to report a sexual assault incident to the police? Discuss options and provide information about local resources. What should a paramedic advise a patient who has been sexually assaulted regarding personal hygiene? Advise the patient not to wash, urinate, or defecate until an examination is conducted at the receiving facility. What should a paramedic do upon police request in a reported sexual assault case? Bag the stretcher linen, dressings, and other materials in contact with the patient, and leave with the attending police officer. Under what circumstances may the MO approve research trials that include different patient care practices? At its discretion. What must a paramedic do if enrolled in an approved research trial? Determine whether a patient may be treated in accordance with the research trial. What conditions must be met for a paramedic to treat a patient in accordance with a research trial? MO approval of the patient care practices and approval of the research trial by Research Ethics Board. What must a Research Ethics Board do to approve a research trial? Abide by and be consistent with the Tri-Council Policy Statement on Ethical Conduct for Research Involving Humans. What version of the Tri-Council Policy Statement on Ethical Conduct for Research Involving Humans must the REB abide by? The version current at the time of submission. What are the requirements for NREB? Meets requirements in Section 15 of OREG 329/04 under FIPA. What does Section 44 of FIPA include? Provisions related to personal health information and researchers. Who reviews and supports the research trial? Ontario-based Hospital Group Medical Advisory Committee. What does the paramedic need to obtain for participation in the research trial? Appropriate patient consent. What does the General Measure Standard specify about consent? Paramedics shall obtain consent for patient care as per the Healthcare Consent Act, 1996. What are medical standards based on? Chief complaint, presenting problem, or critical findings. What should paramedics be aware of? Patient's potential to deteriorate. What should paramedics pay particular attention to? Airway, breathing, circulation, seizures, and emesis. What factors should paramedics determine? Provoking factors, quality, region/radiation/relieving factors, severity, and timing of the chief complaint or presenting problem. What should paramedics ensure when providing patient care? Simultaneous care in accordance with the ALSPCS. What is ALSPCS? Advanced Life Support Patient Care Standards. What is the purpose of medical standards? To guide paramedics in providing appropriate care. What is the role of chief complaint in medical standards? It helps determine the basis for medical standards. What should paramedics do to prepare for a patient's potential deterioration? Be aware and ready for any changes in the patient's condition. What are some potential compromises to be aware of? Airway, breathing, circulation, seizures, and emesis. What are potential life/limb/function threats in non-traumatic abdominal pain? Leaking or ruptured abdominal aortic aneurysm, ectopic pregnancy, other non-abdominal disorders that may present with abdominal pain, perforated or obstructed hollow organs with or without peritonitis, acute pancreatitis, testicular torsion, pelvic infection, and strangulated hernia. What should the paramedic assess during a secondary survey of the abdomen? Pulsations, scars, discoloration, distension, messes, guarding, rigidity, and tenderness. What should the paramedic do if a pulsatile mass is discovered during the assessment? Not initiate or discontinue further abdominal palpation. What should the paramedic do if an abdominal aneurysm is suspected? Palpate femoral pulses for weakness/absence. What should the paramedic observe for during the assessment? Melena, hematemesis, or frank rectal bleeding. What is an airway obstruction? Blockage of the airway that prevents normal breathing. What are some causes of airway obstruction? Smoke inhalation, anaphylaxis, epiglottitis, foreign body aspiration, or oropharyngeal malignancy. What should a paramedic do in situations involving a patient with an airway obstruction? Perform assessments and obstructed airway clearance maneuvers as per current Heart and Stroke Foundation of Canada guidelines. What is the recommended method to clear the airway in an airway obstruction? Attempt to clear the airway using oropharyngeal/nasopharyngeal suction. When should the possibility of airway obstruction be considered? For patients who have smoke inhalation, anaphylaxis, epiglottitis, foreign body aspiration, or oropharyngeal malignancy. What is an allergic reaction? An immune response to a specific substance. What are some common allergens? Penicillin, latex, bee/wasp/hornet venom, seafood, nuts, strawberries, melons, eggs, bananas, sulfites. What should a paramedic consider in situations involving a patient with an allergic reaction? Potential life/limb/function threats, such as anaphylaxis. What should a paramedic do in situations involving a patient with an allergic reaction? Perform a secondary survey to assess the site of allergic reaction, lungs, and skin. What are some manifestations of anaphylaxis? Respiratory, cardiovascular, neurological, gastrointestinal, dermatological/mucosal. What are some historical findings that may indicate suspected anaphylaxis? Difficulty swallowing/tightness in the throat, difficulty breathing/feeling of suffocation, fearfulness, anxiety, agitation, confusion, feeling of doom, generalized itching, history of any body system involvement listed in paragraph 3. What potential problems should a paramedic prepare for in situations involving a patient with an allergic reaction? Cardiac arrest, airway obstruction, anaphylaxis, bronchospasm, hypotension. Altered level of consciousness standard. Guidelines for managing patients with suspected acute altered level of consciousness. Specific cause. Determining the underlying reason for the altered level of consciousness. Further assessment and management. Continuing to evaluate and treat the patient based on established protocols. Secondary survey. Comprehensive assessment of the patient from head to toe. Trauma assessments. Evaluating for potential injuries if trauma is suspected or cannot be ruled out. Unprotected airway. When the patient's airway is not adequately protected. Oropharyngeal airway/nasopharyngeal airway. Inserting a device to maintain an open airway. Apneic. When the patient is not breathing. Respirations are inadequate. When the patient's breathing is insufficient. Ventilate the patient. Providing artificial ventilation to support breathing. Respiratory failure standard. Guidelines for managing patients with respiratory failure. What is back pain? Pain in the back without any traumatic cause. What potential threats should be considered in a patient with non-traumatic back pain? Abdominal/thoracic aortic aneurysm, acute spinal nerve root compression, intra-abdominal disease, possible occult injury. What should be assessed in the secondary survey for a patient with non-traumatic back pain? Abnormal appearance/findings in the back, chest standard, abdomen standard, distal pulses, and extremities. What should be done if a thoracic aneurysm is suspected? Perform bilateral blood pressures. What are some potential causes of non-traumatic back pain? Abdominal/thoracic aortic aneurysm, acute spinal nerve root compression, intra-abdominal disease, possible occult injury. What is the purpose of the secondary survey for a patient with non-traumatic back pain? To assess for abnormal findings in the back, chest, abdomen, distal pulses, and extremities. What should be assessed in the back during the secondary survey for non-traumatic back pain? Abnormal appearance/findings. What should be assessed in the chest during the secondary survey for non-traumatic back pain? As per chest pain standard. What should be assessed in the abdomen during the secondary survey for non-traumatic back pain? As per abdominal pain standard. What should be assessed in the extremities during the secondary survey for non-traumatic back pain? Circulation, sensation, and movement. What should be done if a thoracic aneurysm is suspected? Perform bilateral blood pressures. What are some potential causes of non-traumatic back pain? Abdominal/thoracic aortic aneurysm, acute spinal nerve root compression, intra-abdominal disease, possible occult injury. What is the purpose of the secondary survey for a patient with non-traumatic back pain? To assess for abnormal findings in the back, chest, abdomen, distal pulses, and extremities. What should be assessed in the back during the secondary survey for non-traumatic back pain? Abnormal appearance/findings. What should be assessed in the chest during the secondary survey for non-traumatic back pain? As per chest pain standard. What should be assessed in the abdomen during the secondary survey for non-traumatic back pain? As per abdominal pain standard. What should be assessed in the extremities during the secondary survey for non-traumatic back pain? Circulation, sensation, and movement. What is the first step in managing a patient with cardiac arrest? Position the patient on a firm surface. What is the second step in managing a patient with cardiac arrest? Initiate CPR, including defibrillation. When should chest compressors be switched during CPR? Approximately every 2 minutes when 2 or more CPR-certified rescuers are available. What equipment should be readily available in preparation for emesis? Suction equipment. When can the use of mechanical CPR devices be considered? When limited rescuers are available, for prolonged CPR, or in a moving ambulance. What monitoring technique may be considered if available during cardiac arrest? End-tidal carbon dioxide monitoring. When should a patent airway be established? right after initiating CPR/defib. What should be considered during cardiac arrest resuscitation? Reversible causes of cardiac arrest and further assessment and management as required. When should cardiac arrest resuscitation measures be continued? Until a TOR order is received. What should be done if the patient has a spontaneous return of circulation? Uterine displacement. The act of manually moving the uterus to the left side of the abdomen to relieve pressure on the vena cava and improve blood flow during CPR in a pregnant patient. What is a cerebrovascular accident? A stroke. What are some conditions that may mimic a stroke? Drug ingestion, hypoglycemia, severe hypertension, CNS infection. What should the paramedic assess in the head/neck? Facial symmetry, pupillary size, equality, reactivity, abnormal speech, presence of stiff neck. What should the paramedic assess in the central nervous system? Abnormal motor function, sensory loss. What else should the paramedic assess for? Incontinence of urine/stool. How should the paramedic support the patient's body/limbs during movement? Ensure adequate support and place extra padding and support beneath affected limbs. What potential problems should the paramedic prepare for during a stroke? Possible airway obstruction, decreasing level of consciousness, seizures, agitation, confusion, or combativeness. When should the paramedic ventilate the patient during a stroke? If the patient is apneic or respirations are inadequate. What ATCO2 values should the paramedic attempt to maintain during ventilation? 35 to 45 mmHg. When should the paramedic hyperventilate the patient during ventilation? If signs of cerebral herniation are present after addressing hypoxemia and hypotension. What are signs of cerebral herniation? Deteriorating GCS less than 9 with dilated and unreactive pupils, asymmetric pupillary response. How should a patient be hyperventilated if ATCO2 is not available? Adult, 20 breaths per minute, child, 25 breaths per minute, infant less than 1 year old, 30 breaths per minute. What is the Los Angeles Motor Scale? A screening tool used to assess for large vessel occlusion stroke. What is the classification if LAMS is greater than or equal to 4? CTS2. What should be documented for patients presenting with CVA/stroke symptoms within 0 to 24 hours? LAMS screen. What are the symptoms consistent with the onset of an acute stroke? Inappropriate words or mute, slurred speech, unilateral arm weakness or drift, unilateral facial droop, unilateral leg weakness or drift. What is the time frame for transporting a patient to a designated stroke center? within 6 hours of symptom onset or last seen in usual state of health. What are the criteria for assessing a patient for contraindications? What should be done if the patient's blood glucose level is corrected but symptoms persist? The patient is not contraindicated as per paragraph 3 above. What are potential life/limb/function threats in a patient with non-traumatic chest pain? Acute coronary syndrome/acute myocardial infarction, dissecting thoracic aorta, pneumothorax, tension pneumothorax/other respiratory disorders, pulmonary embolism, pericarditis. What is the recommended action for a paramedic in situations involving a patient with non-traumatic chest pain? Consider potential threats, acquire a 12-lead electrocardiogram, perform a secondary survey. What should be assessed in the chest during a secondary survey for a patient with non-traumatic chest pain? Subcutaneous emphysema, accessory muscle use, urticaria, indrawing, shape, symmetry, tenderness. What should be assessed in the lungs during a secondary survey for a patient with non-traumatic chest pain? Decreased air entry, adventitious sounds. What should be assessed in the abdomen during a secondary survey for a patient with non-traumatic chest pain? As per the abdominal pain standard. What should be assessed in the neck during a secondary survey for a patient with non-traumatic chest pain? Tracheal position, jugular vein distension. What should be assessed in the extremities during a secondary survey for a patient with non-traumatic chest pain? Leg/ankle edema. What is the STEMI hospital bypass protocol? A protocol for paramedics to follow when suspecting a STEMI in a patient. What are the indications for a patient to be assessed under the STEMI hospital bypass protocol? Greater than or equal to 18 years of age, experienced chest pain or equivalent consistent with cardiac ischemia or myocardial infarction, time from onset of pain less than 12 hours, 12-lead ECG indicates an acute myocardial infarction/STEMI. What are the specific ECG criteria for a patient to be assessed under the STEMI hospital bypass protocol? At least 2 mm ST elevation in leads V1 V3 in at least 2 contiguous leads and or at least 1 mm ST elevation in at least 2 other anatomically. What are contiguous leads? Leads that are next to each other on the ECG. What is the purpose of a 12-lead ECG computer interpretation of STEMI? To identify if there is ST elevation myocardial infarction. What is the role of the paramedic in relation to the 12-lead ECG interpretation? To agree with the computer interpretation of STEMI. What are the criteria to assess a patient for potential contraindications? The criteria listed in paragraph 1. What is the first contraindication to assess for? Inability to secure the patient's airway or ventilate when the patient is CTS1. What are some ECG findings that are consistent with a left bundle branch block? 12-lead ECG consistent with LBBB, ventricular paced rhythm, or any other STEMI imitator. What is the third contraindication to assess for? Transport to a hospital capable of performing percutaneous coronary intervention greater than or equal to 60 minutes from patient contact. What are the complications that would require primary care paramedic diversion? Moderate to severe respiratory distress or use of continuous positive airway pressure, hemodynamic instability, or VSA without return of spontaneous circulation. What are the complications that would require advanced care paramedic diversion? Inadequate ventilation despite assistance, hemodynamic instability unresponsive to ACP treatment, or VSA without ROSC. What should be done if the patient meets the criteria in paragraph 1 and does not have any contraindications? Inform the CACC/ACS of the need to transport to a PCI center. What should be done if the patient does not meet any contraindications or the interventional cardiology program permits transport to the PCI center? Inform the CACC/ACS of the need to transport to a PCI center. What information should be provided to the PCI center? STEMI patient, initials, age, sex, concerns, infarct territory, ECG findings, estimated time of arrival, catchment area. What information should be provided to the PCI center staff upon arrival? Time of symptom onset, time of ROSC, hemodynamic status, medications given, procedure, history of AMI/PCI/CBG, copy of qualifying ECG, copy of ambulance call report. What should the paramedic do once a STEMI is confirmed? Apply defibrillation pads. What is the STEMI hospital bypass protocol? Continue following the protocol even if ECG normalizes after initial assessment. What is the preferred site for intravenous access? Left arm. What should be done if the ECG becomes STEMI positive en route to a non-PCI destination? Evaluate under STEMI hospital bypass protocol. What should be done if the PCI center cannot accept the patient? Consider transport to an alternative PCI center if still meeting STEMI hospital bypass protocol. What is dysphagia? Difficulty swallowing. What are potential life/limb/function threats in a patient with dysphagia? Anaphylaxis and upper airway infections. What should the paramedic consider in a patient with dysphagia? Potential threats and perform a secondary survey. What should the paramedic assess in the head/neck of a patient with dysphagia? Drooling, hoarse voice or cough, nasal flaring, swelling, or masses, and tracheal deviation. What should the paramedic assess in the lungs of a patient with dysphagia? Adventitious sounds through auscultation. What should the paramedic not do if epiglottitis is suspected? Not open and inspect the airway. What should the paramedic do if epiglottitis is suspected and oxygen administration is indicated? Attempt to minimize agitation. How should the paramedic position the patient with dysphagia? Sitting or semi-sitting. What should the paramedic prepare for in a patient with dysphagia? Potential problems, including complete airway obstruction. What is epistaxis? Nosebleed. What are potential life/limb/function threats in epistaxis? Upper airway obstruction. What should the paramedic assess in a secondary survey for epistaxis? Estimated blood loss and head/neck for foreign bodies and headache. What should the paramedic attempt to do in epistaxis? Controlled bleeding. What potential problems should the paramedic prepare for in epistaxis? Airway compromise and hypotension. What is excited delirium? Impaired thinking and violent struggling induced by various causes. What are potential life/limb/function threats in excited delirium? Asphyxia, cardiopulmonary arrest, dysrhythmias. What are the symptoms of excited delirium? Impaired thought processes, unexpected physical strength, decreased sensitivity to pain, sweating/fever/heat intolerance/dry skin, sudden tranquility after frenzied activity. What should a paramedic consider in situations involving excited delirium? Potential threats, personal safety, violence, police assistance, patient care, advanced care, potential problems. What is the general measures standard? Guidelines for personal safety. What is the violent/aggressive patient standard? Guidelines for dealing with violent or potentially violent patients. What is the police notification standard? Guidelines for involving the police in cases of excited delirium. What is the ALSPCS? Guidelines for advanced patient care. What should a paramedic do in cases of excited delirium? Consider threats, ensure personal safety, handle violence, involve police, provide patient care, prepare for potential problems. What are potential causes of excited delirium? Drug abuse, severe alcohol intoxication, acute psychosis. What are the signs of impaired thought processes in excited delirium? Disorientation, acute paranoia, panic, hallucinations. What are the signs of decreased sensitivity to pain in excited delirium? Significantly decreased sensitivity to pain. What are the signs of physical changes in excited delirium? Sweating, fever, heat intolerance, dry/hot skin with no sweating despite extreme agitation. What is the potential outcome in cases of excited delirium? Sudden death, rapid deterioration. What are potential life/limb/function threats in non-traumatic extremity pain? Acute spinal nerve root compression, B. Possible occult fracture, C. Soft tissue and joint infections, D. Vascular occlusion. What should be assessed in the secondary survey for non-traumatic extremity pain? A distal pulses, B circulation, sensation, and movement, C skin color, temperature, and condition, D swelling, deformity, and tenderness. How should movement to the affected extremity be managed in non-traumatic extremity pain? Keep movement to a minimum, and protect from further injury. What is the definition of fever standard? Guidelines for managing patients with fever. What are the potential life/limb/function threats associated with fever? Overdose, sepsis, meningitis, heat-related illness. What are the criteria for considering sepsis? Fever greater than 38.5 degrees Celsius, possible infection, and presence of specific symptoms. What are the symptoms that indicate sepsis? SBP less than 90, respiratory rate greater than or equal to 22 breaths/minute, acute confusion or reduced level of consciousness. What should be assessed during the secondary survey? Lungs, skin, head/neck, abdomen, and temperature. What should be done to promote passive cooling? Remove excess layers of clothing. Should the paramedic actively cool the patient? No, they should not actively cool the patient. What potential problems should the paramedic prepare for? Seizures in febrile children or adults with suspected serious disorders. What are potential life/limb/function threats in non-traumatic headaches? Intracranial/intracerebral events, CNS/systemic infection, severe hypertension, toxic event/exposure. What signs and symptoms indicate a serious underlying disorder or cause in headaches? What should be assessed in the secondary survey for non-traumatic headaches? Pupillary size, equality, and reactivity in the head/neck, abnormal motor function, sensory loss in the central nervous system. What should the paramedic prepare for in non-traumatic headaches? Potential problems including seizures. What are some heat-related illnesses? Heat syncope, heat cramps, heat exhaustion, heat stroke. What are the symptoms of heat cramps? Severe cramping of large muscle groups. What are the symptoms of heat exhaustion? Mild alterations in mental status, non-specific complaints, excessive sweating in healthy adults, hot dry skin in the elderly. What are the symptoms of heat stroke? Severely altered mental status, coma, seizures, hyperthermia greater than or equal to 40 degrees Celsius. What substances can lead to heat stroke? Overdose of tricyclic antidepressants, antihistamines, B blockers, cocaine, ecstasy, or amphetamine abuse. What assessments should be performed for a patient experiencing a heat-related illness? Secondary survey to assess central nervous system, mouth, skin, extremities, temperature. What should be done if a patient is experiencing a heat-related illness? Move the patient to a cooler environment, remove heavy or excess layers of clothing, provide water or electrolyte-containing fluids if conscious and able to understand directions, move the patient to the ambulance if heat exhaustion is indicated, withhold oral fluids if heat stroke is indicated. What is the minimum action required for a paramedic in situations involving a patient experiencing a heat-related illness? What are the cooling procedures for a patient? Cover the patient with wet sheets, and apply cold packs to axilla, groin, neck, and head.